Earlier, we told you about a press conference from Governor Greg Abbott detailing the hospital situation in Texas amid the coronavirus pandemic. While today marked a new high for COVID-19 cases in Texas, with 2,622 reported as of this afternoon, Governor Abbott said he feels optimistic about the hospital situation in the state. He also gave specific praise to the city of Amarillo for its efforts to contain the disease after receiving nationwide recognition as a hot zone for new infections. Governor Abbott now joins us live with more on what the prognosis is for the state's response to the virus and what made Amarillo's response so notable. Governor, you set the tone for today's conference in your first couple of sentences. You used the phrase abundant hospital capacity. You said coexistence with COVID-19. You said you wanted to provide some context to the cold numbers. So for those who missed that conference today, what are you seeing in the stats that make you optimistic about our ability to handle this latest increase?
Sure. This is so important because there have been some headlines across the state and across the country raising alarms about the number of people hospitalized in the state of Texas. And yes, there are more people hospitalized in the state of Texas because of COVID-19. However, understand this, we have abundant hospital capacity. We talked about 5 stages of hospitalizations in the state of Texas. We are at the safest stage right now. We have 4 other stages we can move to if ever our capacity gets limited. But we're not even close to having current hospital capacity limited. So we're not even close to anything like what happened in New York or New Jersey or other places where they ran out of hospital beds. But I did, of course, applaud Amarillo for the great job it did to contain the coronavirus in your area.
And you mentioned how we moved from that hot spot to the flattening of the curve. But of course, as you know, a lot of the cases we had were in those congregated settings, as you referred to them, like the meat plants, prisons, that kind of thing. So can you use the strategies that worked here also in the higher populated urban areas like Austin, where the numbers are spiking, or is another approach needed to some of those cities?
You used a great phrase, and that is, listen, the approach that we take depends upon the circumstances that we're dealing with. You mentioned congregated settings. It could be meat packing plants, it could be nursing homes, it could be jails, and we have one approach for that. There is another approach that we are dealing with, another type of outbreak that we are facing. There was a story in the Lubbock paper about how more than half of the people who've tested positive in Lubbock County since June the 1st are people under the age of 30. The same thing has happened in many other counties across the state of Texas. We don't know for sure, but here's what we think is happening, and that is that people in that age group are congregating at bars and spreading COVID-19 at bars. And the response to that is something that was announced earlier, and that is TABC is going to be strictly enforcing the protocols and standards that bars are supposed to comply with that should maintain control of the coronavirus. Any bar that fails to comply with those protocols will have their license suspended.
And following up on that, is the manpower there available to do just that, where you can have agents or local law enforcement that decide that for the next couple of weekends, if you see clusters connected to a specific night spot here or there, that they would focus on those areas?
There is, and hence any establishment anywhere in the state of Texas needs to understand at any particular time in the days coming forward that TABC may be showing up and inspecting your facility, making sure that it is in compliance with the standards established for those who sell alcohol.
Governor Dr. John Hellerstedt, the Commissioner of the Texas Department of State Health Services, said at the press conference today that this recent spike was expected but manageable. And then right after that, he said the possibility of a flare-up that would stress the system is still very real. To some, that might sound like a bit of a mixed message. So how do we balance the idea of coexisting with the virus but still being aware of the danger?
Well, the first part of what he said is something that we said 2 months ago. And that is, as we begin to open up, as any state or country begins to open up, until we have medicines that treat COVID-19, there is the expectation and certainly the possibility that you will see an increase in the number of coronavirus cases. What he was talking about a flare-up, and that is there can be other different types of hotspots arise, whether it be connected to bars, whether it be connected to certain types of events. Like one reason we believe that we have seen an increase in people testing positive over the past couple of weeks is in the aftermath of the Memorial Day celebration. And it's things like that that can lead to an increase for a short period of time. And then our goal is to go in and make sure the resources are provided that we can tamp down that flare-up and get it contained and under control, just like what we did in Amarillo.
Governor, parents and teachers are already looking to the next school year. They're wondering where things stand in terms of returning to campuses. So what kind of conversations are you having along those lines?
We've been working closely with the head of the education agency, and we expect an announcement to come either later on this week or next week to let all school districts and parents and students and teachers across the entire state of Texas know what the options are. But the goal in general is to ensure as much opportunity as possible for students to be in classrooms with teachers, with their fellow students, engaged in the same types of activities they were engaged in when they returned to school last year.
Last question. High school athletes have been gathering for workouts now, but we're getting reports of athletes like Ezekiel Elliott testing positive. Has that changed the prognosis in that area in terms of competition and fans gathering?
It hasn't. There was the expectation all along that when these athletes come back together, that some will test positive. And I've talked to coaches as well as athletic directors about this concept, and they know that they need to be testing their athletes. They have dealt with this. They told me they dealt with this in H1N1 a decade ago, where some of the student athletes would test positive, and they had ways to cordon off to contain it, and they are prepared to do the same thing this time. There's a different standard for those in the fans that we have established, working with our doctors to make sure there are safe protocols in place as fans do go into stands, making sure they do so in ways that limit the spread of COVID-19.
Governor, we appreciate your time today. Look forward to talking to you again soon, sir.
Thank you so much, and you all be safe.
Thank you.